Hello everyone. Next we are continuing the part 3, question number 32. The streptococci of the oral cavity may cause systemic infection. The streptococci of the oral cavity may cause systemic infection such as option A osteoarthritis, thyroiditis, nephritis, gastritis. Option B rheumatoid arthritis, bacterial arthritis, nephritis, gastritis. Option C rheumatoid arthritis, thyroiditis, pancreatitis and nephritis. Option D is tonsillitis, nephritis, blepharitis. Here the right answer is option B, rheumatoid arthritis, bacterial arthritis, nephritis and gastritis. Next we are seeing question number 33. Question number 33, that is the temperature of water for the sponge bath and bathroom bath, choose the correct pair. ಸೊ ಯಾವಾಗಲೂ ಬಾತ್ರೂಮ್ ಬಾತ್ಗೆ ಟೆಂಪ್ರೇಚರ್ ಜಾಸ್ತಿ ಇರಬೇಕು ಕಂಪೇರ್ಡ್ ಟು ಸ್ಪಾಂಜ್ ಬಾತ್, ಬಿಕಾಸ್ ಪೇಷಂಟ್ ಎಕ್ಸ್ಪೋಜರ್ ಬಾತ್ರೂಮ್ ಬಾತಲ್ಲಿ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಎನ್ವೈರ್ಮೆಂಟಲ್ ಎಕ್ಸ್ಪೋಜರ್. ಸೊ ಕೊಟ್ಟಿರೋ ಆಪ್ಷನ್ನಲ್ಲಿ ಹಿಯರ್ ದ ರೈಟ್ ಆನ್ಸರ್ ಈಸ್ ಆಪ್ಷನ್ ಎ 96 ಡಿಗ್ರಿ ಫ್ಯಾರನೀಟ್ ಟು 105 ಫ್ಯಾರನೀಟ್. ಬಾತ್ರೂಮ್ ಬಾತ್ ಟೆಂಪ್ರೇಚರ್ ಎಷ್ಟಿರಬೇಕು? 110 ಡಿಗ್ರಿ ಫ್ಯಾರನೀಟ್ ಟು 115 ಡಿಗ್ರಿ ಫ್ಯಾರನೀಟ್ ಇರಬೇಕು. ಸೊ ಹಿಯರ್ ದ ಆನ್ಸರ್ ಈಸ್ ಎ. Next we will move on to question number 34. ಡೈರೆಕ್ಟ್ ಕಾಸ್ ಆಫ್ ಡಯಾಬಿಟಿಸ್ ಅಲ್ಸರ್. ಡಯಾಬಿಟಿಸ್ ಅಲ್ಸರ್ನ ಡೈರೆಕ್ಟ್ ಕಾಸ್ ಯಾವುದು ಅಂತ ಕೇಳಿದ್ದಾರೆ. ಪ್ರೆಷರ್, ಇಂಪೈರ್ಡ್ ಸರ್ಕ್ಯುಲೇಷನ್, ಇಮ್ಯಾಸಿಯೇಷನ್, ಪ್ಯಾಥೋಜನ್ಸ್. ಆಪ್ಷನ್ ಬಿ ಫ್ರಿಕ್ಷನ್, ಎಡಿಮಾ, ಒಬೆಸಿಟಿ, ಪ್ರೆಷರ್. ಆಪ್ಷನ್ ಸಿ ಪ್ರೆಷರ್, ಫ್ರಿಕ್ಷನ್, ಮಾಯ್ಶ್ಚರ್, ಪ್ಯಾಥೋಜನ್. ಆಪ್ಷನ್ ಡಿ ಮಾಯ್ಶ್ಚರ್, ಪ್ರೆಷರ್, ಒಬೆಸಿಟಿ and the pathogens. Here the right answer is option A. Here the right answer is option A. For the diabetes ulcer, its the main reason is pressure, impaired circulation, emaciation, pathogen. So these are the reason for diabetic ulcers. So here you can see the option C as well here. That is pressure, friction, moisture and pathogens. This is the reason for the diabetic ulcer. This is the reason for bed sore. This is the reason for the bed sore. Next we will move on to question number 35. Some of the areas of health educations are human biology, communication, hygiene, MCH and family planning, motivation, prevention of accidents. So obviously human biology is the sector of health education. Hygiene, maternal and child health, family planning, prevention of accident. These four are the areas of health education. Communication is a media of health education. Communication, what the process is called communication. Motivation is the principle. Motivation is the principle of health education. Motivation is the principle of health education. So here the right answer is option C. Here the right answer is option C. 1, 3, 4 and 6 only. Next we are moving to question number 36. Question number 36 is consider the following pairs. One-way communication. Learners listen to the message and may raise questions. Two-way communication. The message from sender to receiver. Verbal communication. Use of language, whether spoken or written. Non-verbal communication. Gesture and facial expression. Find out the which of the following pairs are not matching. ಯಾವ ಪೇರ್ ಮ್ಯಾಚ್ ಆಗ್ತಾ ಇಲ್ಲ. ಸೊ ಇಲ್ಲಿ ನೋಡೋದಾಗಿರ್ಬೋದು ನೀವು ಹಿಯರ್ ದ ವರ್ಬಲ್ ಕಮ್ಯುನಿಕೇಷನ್ ಆ್ಯಂಡ್ ನಾನ್ ವರ್ಬಲ್ ಕಮ್ಯುನಿಕೇಷನ್. ವರ್ಬಲ್ ಮೀನ್ಸ್ ದ ಯೂಸ್ ಆಫ್ ಲ್ಯಾಂಗ್ವೇಜ್ ವೆದರ್ ಸ್ಪೋಕನ್ ಆರ್ ರಿಟನ್. ನಾನ್ ವರ್ಬಲ್ means gesture and facial expression. These two are correct answers. And you can see the one-way communication. Learner listen to message and may write the question. This is the two-way communication. This is the two-way communication. And the message from sender to the receiver, this is the one-way communication. Here the 1 and 2 pairs are not correct. Here the 1 and 2 pair are not correct. Answer is option A. Answer is option A, 1 and 2. So we can see here question number 37. Chlorine concentration of 1 gram per liter water in direct chlorination method if 1 ounce of bleaching powder for 100 gallons of water. 10 ounce of bleaching powder in 1000 gallons of water. 1 ounce of bleaching powder in 1000 gallons of water. 100 ounce of bleaching powder for 1000 gallons of water. Option here the right answer is option A, 1 ounce of bleaching powder for 100 gallons of water. 1 ounce of bleaching powder for 100 gallons of water. So the chlorine concentration is 1 mg per liter irutte. 1 ounce of bleaching powder na 100 gallons of water ga hakadre per liter 1 mg chlorine water nimge sigutte. Next we will move on to question number 38. ಪ್ರೋಟೀನ್ ಫುಡ್ ಸೋರ್ಸಸ್ ಆರ್, ಇಲ್ಲಿ ಪ್ರೋಟೀನ್ ಸೋರ್ಸಸ್ ಯಾವ್ದಾದಂತ ಕೇಳಿದ್ದಾರೆ. ಸೀರಿಯಲ್ಸ್ ಪ್ರಾಡಕ್ಟ್ಸ್, ಡೇಟ್ಸ್ ಆ್ಯಂಡ್ ಎಗ್ಸ್, ಮೀಟ್, ಕಾರ್ನ್, ಕ್ಯಾಬೇಜ್ ಆ್ಯಂಡ್ ಮಿಲ್ಕ್, wheat, milk, barley and meat, milk, cereal products, meat and eggs. ಹಿಯರ್ ಎಲ್ಲದರಲ್ಲೂ ಒಂದೊಂದು ಪ್ರೋಟೀನ್ ಸೋರ್ಸ್ ಇದೆ, ಬಟ್ ಎಲ್ಲದರಲ್ಲೂ ಪ್ರೋಟೀನ್ ಇರೋದು ಅಂತಂದರೆ ಆಪ್ಷನ್ ಡಿ, ಮಿಲ್ಕ್, ಸೀರಿಯಲ್ ಪ್ರಾಡಕ್ಟ್ಸ್, ಮೀಟ್ ಆ್ಯಂಡ್ ಎಗ್ಸ್, ಮೀಟ್ ಆ್ಯಂಡ್ ಎಗ್ಸ್. ಹಿಯರ್ ದ ರೈಟ್ ಆನ್ಸರ್ ಈಸ್ ಆಪ್ಷನ್ ಡಿ. ದ ಫ್ಯಾಟ್ soluble vitamins available in food items are the fat soluble vitamins available in food items like whole milk, cereals, vegetable oils and fruits. Option B, pork, tomatoes, meat and corn. Option C, yeast, poultry, milk and peanuts. Option D is milk, fruits, pork and peanuts. So here the answer is whole milk, cereals and vegetable oils and fruits. 39 question answer is option A, whole milk, cereal, vegetable oils and fruits. Next we will move on to question number 40. Clear opaque liquid diets consist of food that are. Example of clear liquid diet ಕೇಳಿದ್ದಾರೆ. Ice cream, chicken broth, soups, strained vegetables, juice. Chicken broth carbonated. ಸೊ ಕಾರ್ಬೋನೇಟೆಡ್ ಬೆವರೇಜ್ನ ಯಾರು ಕೂಡ ರೆಕಮೆಂಡ್ ಇಲ್ಲಿ ಮಾಡೋದಿಲ್ಲ. ಕಾರ್ಬೋನೇಟೆಡ್ ಡ್ರಿಂಕ್ಸ್ನ ಯಾರು ರೆಕಮೆಂಡ್ ಮಾಡಲ್ಲ. ಸೊ ಯು ಕ್ಯಾನ್ ಎಲಿಮಿನೇಟ್ ದ ಆನ್ಸರ್ ಈಸಿಲಿ. Ice cream, carbonated beverages, lemonade, and again you can eliminate the answer easily. Here the right answer is ice cream, chicken broth, soups, strained vegetables and the juice. These are the example of clear liquid diets. And 41, when administering a thrombolytic drug to the client experiencing an MI, the nurse explained to him that purpose of the drug is to. So thrombolytic drug na administer ಮಾಡುವಾಗ what is the purpose of that drug? Option A, keep him hydrated. Option B, dissolves clot that he may have, prevent kidney failure, treat potential cardiac disarrangement. So here the right answer, thrombolytic answer is dissolve the clot that he may have. This is the right answer. Next we are going to see question number 42. In post anesthesia care unit, priority nursing assessment is. In post anesthesia care unit, the priority assessment is option A, monitoring of urinary output, option B, airway potency, option C, ECG, option D, level of consciousness. Here ಎಲ್ಲವೂ ಕೂಡ ಮಾನಿಟರಿಂಗ್ ಮಾಡಬೇಕಾಗಿರುತ್ತೆ, ಬಟ್ the priority assessment is to see the airway. Either patient is in tracheostomy or room air or in endotracheal tube, we have to see the airway if patient is getting enough oxygen. Next we were moving to question number 42. What is the early sign of breast cancer? Breast cancer na early sign anta kelidare. What are the early signs of breast cancer? Here the early signs anta bandre mobile mass, immobile mass, increased tissue size, all of the above. Here we can categorize. Now we'll categorize ಮಾಡಬೇಕು early and late sign ಅಂತ. Here the early sign is the mobile mass. ಪೇಷಂಟ್ ಕಂಪ್ಲೇಂಟ್ ಮಾಡ್ತಾರೆ, ಬ್ರೆಸ್ಟ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಆದಾಗ ಏನೋ ಓಡಾಡ್ತಾ ಇರುವಾಗೆ ಅನಿಸುತ್ತೆ, ಏನೋ ಮೂವ್ ಆಗ್ತಾ ಇರೋ ಒಂದು ಗಡ್ಡೆ ನನ್ನ ಹತ್ರ ಬ್ರೆಸ್ಟ್ ಟಿಶ್ಯೂನಲ್ಲಿ ಇದೆ ಅಂತ. ಸೊ ದಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಆಸ್ ಮೊಬೈಲ್ ಮಾಸ್. ಸೊ ಇಮ್ಮೊಬೈಲ್ ಮಾಸ್ ಟಿಶ್ಯೂ ಸೈಜ್ ಇನ್ಕ್ರೀಸ್ ಆಗೋದು ಅಥವಾ ನಿಪ್ಪಲಲ್ಲಿ ಸೆಕ್ರಿಷನ್ ಬರೋ ಅಂಥದ್ದು, ದೋಸ್ ಆರ್ ದ ಲೇಟ್ ಸೈನ್ ಆಫ್ ದ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್. Those are the late sign of the breast cancer. Next we will move on to question number 44. Persecutory delusion is common in. The persecutory delusion is common in catatonic schizophrenia, paranoid schizophrenia, manic depressive psychosis, bipolar affective disorder. Here the persecutory delusion is paranoid schizophrenia dalli ನೋಡಬಹುದು. paranoid schizophrenia dalli ನೀವು ಇದನ್ನ ನೋಡಬಹುದು. persecutory delusion means patient ಏನು ಹೇಳ್ತಾರೆ, somebody is ಟಾಕಿಂಗ್ ಟು ಮೀ, somebody is following me, ಯಾರೋ ನನ್ನನ್ನು ಫಾಲೋ ಮಾಡ್ತಿದ್ದಾರೆ ಆವಾಗಿಂದನು, ಬಟ್ ದೇರ್ ಇಸ್ ನೋ ಫಾಲೋವರ್ಸ್, ಅವ್ರಿಗೆ ಯಾವುದೇ ರೀತಿ ಫಾಲೋಯಿಂಗ್ ಕೂಡ ಇರೋದಿಲ್ಲ, ಆದರೆ ಪೇಷಂಟ್ ಈಸ್ ಟೆಲಿಂಗ್ ದಟ್ ಯಾರೋ ನನ್ನನ್ನು ಆವಾಗಿಂದನು ಫಾಲೋ ಮಾಡ್ತಿದ್ದಾರೆ. ಸೊ ದಟ್ ಈಸ್ ಪ್ಯಾರನಾಯ್ಡ್ ಬಿಹೇವಿಯರ್. ಕ್ವಶನ್ ನಂಬರ್ 45. Physical symptoms in psychomotor disorders are. The physical symptoms in psychomotor disorders are caused by emotional factors, physical factors, environmental factors, genetic factors. Here the right answer is option A, emotional factors. Psychosomatic disorder ಅಲ್ಲಿ emotional factor ಇಂದ physical symptoms ಬರುತ್ತೆ. So question number 46. That is, extrapyramidal symptoms are complication of treatment with following drug. Which of the drugs are causing extrapyramidal symptoms? Option A, antipsychotic drugs. Option B, anti-anxiety drug. Option C, antidepressants. Option D, anti-malarial drugs. Here the right answer is antipsychotic drugs. Antipsychotic drugs ಇಂದ ಎಕ್ಸ್ಟ್ರಾ ಪಿರಮಿಡಲ್ ಸಿಂಪ್ಟಮ್ಸ್ ಪೇಷಂಟ್ಗೆ ಬರ್ತಾ ಹೋಗುತ್ತೆ. ಸೊ ಇಫ್ ಯು ಆರ್ ಗಿವಿಂಗ್ ಆಂಟಿಸೈಕೋಟಿಕ್ ಡ್ರಗ್ಸ್ ಮೀನ್ಸ್ ನಾವು ಎಕ್ಸ್ಟ್ರಾ ಪಿರಮಿಡಲ್ ಸಿಂಪ್ಟಮ್ಸ್ನ ಕೂಡ ನೋಡ್ತಾ ಹೋಗಬೇಕು. ಬಿಕಾಸ್ ದಟ್ ಇಂಡಿಕೇಟ್ಸ್ ದ ಸೈನ್ ಆಫ್ ಡ್ರಗ್ ಓವರ್ ಡೋಸ್ ಅಥವಾ ಟಾಕ್ಸಿಸಿಟಿ ಆಗಿರೋದು. 47. Consider the following. Option 1 is accident, criminality, marital disharmony, financial difficulties, divorce, occupational problems, and the seizures. Which of the above is not a social problem? So accident, here the accident is social problem. Criminality is the social problem. Marital disharmony is the social problem. Financial difficulties is a social problem. Divorce is a social problem. Occupational problems are the social problems. Here the seizures are not the social problem. They are from any disease ಅಥವಾ they are biological, ಬಾಡಿಗೆ ಇಂದ ಬರುವಂಥದ್ದು. ಸೊ 7 only. Here the right answer is 7 only. It's not a social problem, it's a health issue. So next we will move on to question number 48. That is, which of the following combination drugs are prescribed for a mania? 1 is lithium carbonate, carbamazepine, valproic acid, imipramine, trimipramine, clomipramine. Option 3 is Buspirone, alprazolam, lorazepam. Option 4, lithium carbonate, clomipramine and Buspirone. Here the answer is option A, 1 only. Many patient ಗೆ ಯಾವಾಗಲೂ ಮೂಡ್ ಸ್ಟೆಬಿಲೈಸರ್ಸ್ ನ ಕೊಡ್ತಾರೆ. So these are the mood stabilizers: lithium carbonate, carbamazepine and valproic acid. Option A is the right answer. Unintentional administration of solution or medication into the surrounding tissue leads to infiltration and edema, phlebitis and induration, infiltration and extravasation, swelling and bleeding. Here the right answer is infiltration and extravasation. Means infiltration, drug surrounding tissue ge enter ಆಗುತ್ತೆ, so that causes swelling. But extravasation means that causes the effect. Blister form ಮಾಡ್ಬೋದು, irritant ಆಗಿ cell death ಆಗ್ಬೋದು, necrosis ಆಗ್ಬೋದು. So that is called the extravasation. Next we will move on to 50th question. Match the following. Hypothermia, blood glucose level 400 mg per deciliter. So that hyperthermia, blood glucose level 50 mg per deciliter. Hypoglycemia, body temperature below 36 degree. Hyperglycemia, body temperature above 40 degrees Celsius. So the hypothermia is body temperature above 40 degrees Celsius. Hyperthermia is body temperature below 36.5 degrees Celsius. Hypoglycemia is blood glucose level 50 mg per deciliter. Hyperglycemia is the blood glucose level 400 mg per deciliter. So here the right answer is option A, 3, 4, 2, 1. ತುಂಬ ಸಿಂಪಲ್ ಆಗಿರೋ ಕ್ವಶನ್ ಇದು. A person aged about 60 years has been diagnosed as hypertensive. So what is the recommended amount of sodium intake for that client? 10 to 20 grams per day, 15 to 20 grams per day, less than 2.5 grams per day, more than 2.5 grams per day. Here the answer is only option 3, because hypertensive patient ke sodium restrict ಮಾಡ್ತೀವಿ, salt restricted diet ಇರುತ್ತೆ. So here the right answer is option C, that is less than 2.5 gram per day. Less than 2.5 gram per day. Next, we will move on to question number 52. The annual income of family belongs to category 2B shall not exceed rupees dash lakh to consider its backward class under creamy layer policy. So this is the question from sociology. Here the right answer is 4.5 lakh. ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ, this question paper came back in 2014 ಅಲ್ಲಿ ಬಂದಿರೋ question paper ಇದು. ಸೊ ಅವಾಗ ಕೇಳಿದ್ರೆ 4.5 lakh ಅಂತ ಇದ್ದಿದ್ದು, ಬಟ್ ಇವಾಗ 2014 ಅಲ್ಲಿ ಅದನ್ನ ಚೇಂಜ್ ಮಾಡಿದ್ದಾರೆ. 2014 ಅಲ್ಲಿ ಅದು ಚೇಂಜ್ ಆಗಿದೆ ಗೈಡ್ಲೈನ್. ಸೊ ದಟ್ ಈಸ್ 8 lakh rupees. That is 8 lakh rupees. 8 lakh rupees ಒಳಗಡೆ ಇನ್ಕಮ್ ಇದ್ದರೆ ಅವರು ನಾನ್ ಕ್ರೀಮಿ ಲೇಯರ್ಗೆ ಬರ್ತಾರೆ. Consider the following. A sprain is an injury to the tendon. A sprain is an injury to the ligament. A sprain is an injury to the bone. A sprain is the injury to the muscle. Here the right answer is a sprain is an injury to the ligament. A sprain is the injury to the ligament. Option D is the right answer. Next we'll see question number 54. The clinical feature of tetanus is lock jaw, muscle spasm, photophobia, irritability, fever, nausea, vomiting, lock jaw, muscle spasm, backache, wound infection, fever, back pain, neck rigidity, and photophobia. The right answer here is option C, 1 only. Lock jaw, muscle spasm, photophobia, and irritability is the symptoms of tetanus.